So this exhibit hall is about medication-assisted treatment, and I'm going to share with you all a little bit about ReVIDA Recovery Centers and what we do and where we are, and a little bit about our mission. Also, at the end, I'm going to share a little bit about waiver information. I know that was a topic that they had shared with me to make sure that I had put in here. So I copied some links that everyone can share with their providers, whatever type of agency that you're in. So we will go on to the next slide. Okay, ReVIDA Recovery Centers. Our mission is to promote safe and healthy communities by empowering individuals to reclaim their lives from opioid use disorder. And we are all across the Appalachian Highlands, all the way from Wytheville, Virginia to Knoxville, Tennessee. We have 7 treatment centers, and we do treat opioid use disorder. And people can come in with all sorts of different substance use, but of course, opioids has to be there. That is what they have to present with first. So we're really proud to serve the people of the Appalachian Highlands. And you can see where we are on the map there, all across Northeast Tennessee and Southwest Virginia. Next. I put some information here from Shatterproof. I just think they do such great work, and I love the information that they share with us about substance use disorder and treatment. And I wanted to share their 8 principles. It's on the next page. And ReVIDA supports these principles as well. Those are on the next page. Okay. Shatterproof has national principles of care, and these 8 principles are really important. And I think that that's something that everyone in treatment should adopt and really stand behind. So I'm just going to go over those quickly and let you all hear about those. First tune is routine screenings in every medical setting, and we do those there at ReVIDA. Have a personal plan for every patient, and we do. At ReVIDA, we do have our case managers, which are nurses. We have our counselors, which are all licensed clinicians. They are either licensed social workers or licensed therapists, one or the other. We're really proud of that. And we have those in all of our offices, as well as our physicians and nurse practitioners. And our physicians are all certified in addiction medicine. So really proud of the clinical teams that we have put together in all 7 of our program locations. Fast access to treatment. We do make sure that we do treat and we do see pregnant patients first. When people call in to schedule an appointment, if they are pregnant, we make sure that they are first to be able to be seen. They get moved to the front of the line. Coordinated care for every illness, and that is something that, of course, is super important in opioid use disorder. And we do have coordinated care with our case management and our therapy services, and then our medication management with the physician. And our case managers, these are either LPNs or RNs, and they do such a great job working with our outside agencies. And that has been my job over the past 4 years working with ReVIDA, is building partnerships with all of our outside agencies from Wytheville, Virginia, all the way through Knoxville. And those outside agencies include your law enforcement, court systems, all your social service agencies, whether it be a domestic violence service or shelter, a homeless shelter, any type of government housing, educational institutions, either GED or higher education, transportation services, food pantries, clothing services, clothing pantries, clothes closets. All of those things are just super important in helping our patients get back on their feet and lead a successful life. And so as far as coordinated care is concerned, our case managers do a great job in connecting our patients to those resources on the outside. And I shared earlier in my presentation before that our patients only see us, just like at other MAT centers. They only see you just for a very short time. They come to see you for their visit either once a week or twice a week, and sometimes monthly, depending on how long they've been with you and how things are going. But that's a very short time that your treatment team gets to see that patient. They're on the outside world more than anything. And so, in order for them to really lead a successful life, they've got to have good partners. We have to have good partners on the outside of our buildings. So when the patient walks outside of the building, they've got connections out there, and that's part of that coordinated care. So we're really proud. I think that's one of the things that sets us apart from other treatment centers, is that we do that probably more than anyone. Behavioral health care from legitimate providers, and we are definitely doing that. Like I was sharing, all of our therapists are either LCSWs or licensed master's level clinicians, and then our counselors are LPCs. Medications for addiction treatment, and of course, in our offices, we use buprenorphine when medically indicated. And if the patient does present when they come in, and they do present in a fashion that doesn't support that, then of course we're going to deem them not viable for treatment, and we're going to refer them to somewhere else. And then lastly, support for recovery outside of our doctor's office. And this goes back to those coordinated care with outside organizations. Also, emotional and practical support with family members. And so we do work with our patients on how to rebuild connections with family and friends, and also with peer groups on the outside of our offices. We really work with other agencies and other partners to get our patients going to group meetings and that type of thing. All those things are super, super important. And Shatterproof just has all this listed out. And so I wanted to put that on there because that's something that, even though we do all those things, it was great that they had it listed this way. And it's great to show that those 8 things are truly the 8 major principles of care that every treatment organization should be doing. Next. One of the things that I've done and that we work at ReVIDA Recovery Centers is sharing with our community the costs of substance use, the costs of opioid use disorder, and how that affects not only the workplace, but also our community and taxpayer dollars. Those things really do make a difference in how we work with our community members. And so I pulled up some figures, and I wanted to share with you all today that on the National Safety Council's website, there is a calculator on there. It's called a workplace cost calculator. And it's awesome because you can put in there all sorts of different types of labor fields in there, what type of industry that you are looking for, and it will tell you the cost of substance use in that type of work environment and what it costs that type of organization when there is substance use in the field. Next. And you can see right here, it actually shows, you can put the numbers in. Now I had put in here, I put the state Tennessee, I had put that it was a manufacturing industry, and I had chosen 50 employees. And it gives you all the factors. It tells you, how much that you have lost in time, how much money you've lost annually as far as durable goods, non-durable goods, the cost in job turnover and retraining, the cost in healthcare, and who is affected, how many employees are affected by that substance use in the workplace, how many dependents and family members are affected when that happens. I mean, it's really interesting what you can find out by using this workplace cost calculator. So I wanted to share that with you all, and I put at the very bottom of this slide from National Safety Council the link, and you can click on that link at nsc.org/forms/substance use employer calculator. It's a tongue twister, but you can put all your different fields in there and find out based on what type of industry, how many employees, what state, and you can find out the cost of people using drugs in the workplace, what that actually costs your place of business. And I think that is that's a very real thing that we need to look at. And if that doesn't speak volumes to your community, then I don't know what will. Okay, next. This is another one. I just upped the numbers to 500 employees. And again, you can see there, it's amazing how much that it costs. I mean, that shows right there, cost and lost time is $59,000, $148,000 it's costing this company. Cost in healthcare, it's costing the company $38,460. Amazing. Next. So treatment. Treatment is something that, there's lots of back and forth about treatment, especially here in rural Appalachia. Some people believe in treatment, some people don't. And of course, every type of treatment is not for everyone. Medication-assisted treatment is for some people. For some people, it's not. Some people need complete abstinence and no type of medication. Some people need all therapy and that type of treatment that's just talk therapy. Some people need to do all faith-based and go that route. It's totally up to the individual and what's going to work best for them. And I'm a huge advocate for that there's not a one size fits all treatment. But I do know that treatment in general works. You just have to find the right one that works for the right person. But I put on here, and this is all again from the National Safety Council and Shatterproof. It shows workers in recovery miss 5 days less work per year than workers with a substance use disorder. Recovery is good for business. And I love this one down here at the bottom. Each employee who recovers from a substance use disorder saves the company more than $3,200 a year. That's a great number to know. Every person that recovers from a substance use disorder saves the company more than $3,200 a year. I love it. So these types of numbers I want to share with you are things you can find also on the National Safety Council's website. And I put the employer toolkit down at the bottom, a link to that, and also a link to Shatterproof's medication-assisted treatment, the tools for that as well. So those are all things that you can use in your place of business or in your center to use in your outreach in your community. Next. Lastly, I wanted to give you all information about ReVIDA, about our company, just contact information. First of all, there's a picture of our Wytheville office in Wytheville, Virginia. That's the lobby, and we're really proud. We just did an overhaul on it, and it looks really nice. And 2 of our other centers look like that now. We're working on overhauling all of them. Our Johnson City office in 2019 won the Reader's Choice for Best Addiction Recovery Center by the Johnson City Press, and we're real excited about that. But our contact information, ReVIDARecovery.com. You can contact us there. My information, I wanted you to have my email and my personal cell phone number. If you have any questions about anything, please let me know. I'm more than happy to answer your personal questions. And also, this is something I shared on my earlier presentation. If you have a family member, a friend, or you just want confidential information about treatment or recovery, you're welcome to contact me or our toll-free number there and talk to anyone at any one of our centers. Your information is confidential, and you have you can have every confidence in knowing that it is that confidential. And then our social media, we do have Facebook pages, one for all 7 of our centers, all 7 of our locations. We have a LinkedIn page, ReVIDA Recovery Centers, and Twitter at ReVIDA Recovery. So there's all sorts of great ways that you can actually find us. The next slide. One Tennessee had asked that since I'm the MAT person here, that I share some information about waivers. Well, not everyone on here is from treatment, but I know that there's a lot of different types of providers that are on here, and they don't all provide medications or buprenorphine, or they don't all prescribe that. But if you are interested in becoming a prescriber and learning more about that, I wanted to have the links for you on here so you can learn more about that. The requirements have just changed. They have taken away the requirement to have a waiver for 30, to be able to prescribe up to 30 patients. But, to prescribe to more than that, to treat more than 30, you do have to have a waiver. And that's different. But to give you all the details, I did put the links on here for you from SAMHSA. There's a quick start guide for providers, facts and questions about practice guidelines, and then how to become a buprenorphine waivered practitioner. And you can read all about those at those links and find out anything and everything that you'd want to know. And I brought all those up myself and made sure that everything was on there for you. There was a question about pregnant patients. Yes, we do take pregnant patients, and pregnant patients are our top priority. As when people call in to get an appointment, if they're pregnant, we are going to find a way, make a way for them. We're never going to put a pregnant person on a wait list. We're going to make sure they get seen. We're going to find a spot for them. That's just for sure. We just do. So yes, we take pregnant patients. And in fact, we work with a company also called Strongwell. And Strongwell has certified peer recovery specialists that work specifically with our pregnant patients and make sure that they link arms with our pregnant women and serve as a liaison to them on the outside of our offices, and make sure that they get to all of their OB/GYN appointments, all their well baby checks after the baby's born, and all that good stuff. So they work with our pregnant patients hand in hand, face to face. They're wonderful. And so we have special services actually for pregnant patients. Any other questions?
Thank you. I chatted in one more about your location. I obviously heard Virginia, but for Tennessee, primary Johnson City and down to Knoxville?
Yes, we have Johnson City, Morristown, Newport, and Knoxville. We have 4 in Tennessee. Yeah. And I think you asked, were we the only, did you ask if we were the only one in Johnson City, or if that was our only one?
Right. I was just wondering locations. We're across the state, and so we try to share different resources and need to know. I don't want to share it with Memphis, and I know you're not really there.
Yeah, right. You. Yeah. Our 4 in Tennessee are Johnson City, and then Morristown, and then Newport, and then Knoxville. So that's going east to west right there. But our furthest one is Knoxville, and that's the furthest that we are right now. We hope to go further, but that's where we are right this minute. Any other questions? Be glad to answer anything you have. Amy or Wayne?
Yeah, actually, I have a question that has absolutely nothing to do with your presentation. Johnson City, are you familiar with a fellow named Guy Wilson?
Guy Wilson.
Yeah, he owns a big pharmacy up there.
Wilson's Pharmacy?
Wilson's Pharmacy, yes. Yeah, he and his wife Deborah, they're good friends of mine.
Okay.
How
I
about
don't know him, but I know Wilson's Pharmacy. Yeah.
there you go. How about Terry Brymer over in Morristown? You know him?
No, but I think you need to send me their information so I get to know them.
Yeah, there you go. They're all good guys. We're all old folks, but we're still hanging around.
Yeah, I would love if you would just send me their names again, and I would love to go meet with him. In fact, we have a pharmacist on staff, and you know, we don't you know, dispense medication or anything like that, but she works with our chief compliance officer, and so she works with pharmacies more than I do. You know, she calls around pharmacies if there's any problems with anything like that. So I mean, I would love to meet them, but I'd also like to give her their names, so she would likely know them more than I would.
Okay,
that would be wonderful. Yeah. Thank you. That's wonderful.
You bet.
Okay.
I have a
Really
quick
appreciate
question,
it.
Mrs. Amy. Do you take the women postpartum, and can the baby stay with the mothers when they're in treatment?
Okay, all of our treatment is outpatient, so we're not inpatient.
Okay, I was a little late. I had another meeting I had to be in. So.
Oh, that's okay. That's okay. Yeah, we're all outpatient, and so that makes it really nice that of course, you know, some people have to have inpatient, but if they can do outpatient, it's really great because they can stay working if they have a job, and if they don't, then we work with workforce development, and then people like Jason Pritchard, which if y'all heard him earlier, we work with their CPRSs to get our patients, you know, back into the workforce as well.
Okay, great. Thank you so much.
Yeah. Anything else? Well, I'll ask you all a question. And I know y'all maybe are ready to go eat lunch, but I think most of y'all were in the earlier session where I presented as well. Is there anything that you all see about what we do at ReVIDA that's different from other companies that maybe that we could use, you know, where we would know that we are doing something different, you know, because we don't always look around and know everything, but I'd like to know where we are maybe doing something great, or maybe where we are falling short. We'd love to know have your opinions and input, because we are always trying to be better and do better.
If a mother doesn't have Medicaid or TennCare, do you help with the enrollment process then?
We can. We don't do that in-house, but we have partners that help with that. Yeah. Absolutely. Absolutely. Appalachia Service Project is one that we work with. There's a lot that we partner with that, you know, if they're not on government assistance already, that we feel like they could qualify for it, we know who to send them to help them.
Okay.
Okay. Okay. Anything else? Thank you, Wayne. I see your message. Thank you for those names. Really appreciate that. Okay.
You're very
All right.
welcome.
Okay. All right. Well, I guess if that's all, I think we may be done, Cassandra.